Welcome back to our second Action for Elders video looking at help with arthritis. In the first of these videos we were talking very much about how to move the body in a relaxed way and how to follow movement without strain. So we're going to reinforce that message here, and we're going to look at introducing movement for some other parts of the body. Important thing, as I said earlier, is not to push your body, not to strain your body. If you get pain, reduce the movement. Okay, so one of the things when we think about relaxing the body, sometimes you say to people relax and they do this. That's collapsing. That's a different word. That's changing the position. Relaxing is not changing the position, it's maintaining the posture but with less tension. It's more relaxed posture. So that's what we want to adopt, a relaxed posture, relaxed movement, comfortable movement, circular movement, easy movement, pain-free movement. That's what we're looking for. So as you sit nice and upright, I want you to open the palms of your hands, open the soles of your feet, lengthen up in your spine, take a nice deep breath in, open your palms, and then just gently open out to the side. So not to lift the shoulders, just to drop the shoulders and open out. And as you open your chest and open the shoulders at the back. Relaxing back in, hands to the centre, taking a nice breath, breathing in, open out and relax to the side. So start to feel your chest stretching and softening. One of the things with stress is this tension in the chest, isn't it? So this exercise will help us release that stress by opening the chest, relaxing the heart and helping the lungs. So nice gentle opening stretch to begin the session. The second thing we're going to do then is with a similar exercise, except this time we're going to turn. And again, we think about language and how we're describing the movement. We're not twisting the body, we're turning the body. Twisting is uncomfortable, twisting is strain, turning is comfortable. So, hands up again, breathing in, and this time when you breathe out, I want you to follow the movement by turning with your head. And now we're turning the spine, and we're opening the chest and the shoulders. So we're opening the spine, and we're beginning to soften the rib cage, breathing in, and then relaxing out, and following the movement to the side. Now it's not a competition. If I try and push too far and turn too far, I'm going to tense. So to open, lengthen up, lengthen out, and then relax gently back to the centre. So once more each side. The thing with all these exercises is to make them comfortable, to breathe easily, and use your breath when you breathe out to help relax the feeling inside. And the feeling wants to be of ease, of opening the joints, relaxing the body, and getting a nice, comfortable, soft movement. Good. And then relax gently down. The next thing to think about then is not just the movement and the relaxation, but also the strength. Now I'm going to turn sideways to show you this one, because this one is going to be looking at the back. And we've opened the top part of the spine. We're going to open the bottom part of the spine by stretching the back. And we're going to stretch and we're going to develop strength at the same time by using the muscles either side of your spine to lift your body up. So normally when we go forward and we come up, we tend to lift the shoulders up. And I want you to relax your shoulders and lengthen your spine out. So nice upright posture, breathing in, follow your hands like we did in the first video, then the elbows, then the shoulders. Now you'll feel your back is already stretching. And I don't need to force the stretch, just comfortable. And then when you come down, keep your head level, not to go too low, particularly if you have heart problems. So then when you breathe in, come up, opening up with a nice straight back. Lengthen out first with your hands, follow with your elbows and your shoulders. Stretch the lower back, level with the spine, and then just a little encouragement from your legs up into the back. Now I've shown you that a couple of times, but obviously you can repeat that as many times as you like. It's important to keep a strength, and part of that strength in the lower back allows you to sit upright. If I'm having to hold myself up, I get tired and I go back down. So strengthening the muscles in your back will help to keep this nice upright posture. Good. So moving on from there then, we're thinking about the lower body, and we're thinking about the leg, the knee, the hip, the ankle, the foot. So here, same that we did when we moved with following movements in the upper body, we follow the movements in the lower body. So we're going to start, look at your foot and just lift up the heel and roll round on the ball of your foot and your toes. Now I'm resting my hand lightly on my knee to feel the knee moving. You can also rest your hand on your leg if you like, or you can rest in your hip to feel the movement, so you feel what's going on. And what I'm doing is I'm relaxing my knee and I'm following the movement of my foot. So my ankle starts to stretch and move, my knee moves because it's following my ankle, and my hip moves because it's following my knee. So these joints can relax, change direction, and I can follow the movement. So it's a relaxed, easy movement to allow that circulation to come. I'm not moving my knee. I'm moving my foot, and my knee is following. And that's a very different way of thinking about the movement. Change side. So we can actually move these joints that are painful when they're relaxed. Rest your hand if you like to feel that movement. And then change direction. And as you're making this movement, try and feel what's happening in the joints. See what's the sensation in the joint. How does it feel it affects it? What's the benefit of the movement? How does it ease the discomfort? Good. Now we're going to continue with circles. This circle is a circle with your foot on the floor. And again, as you make this circle, I want you to relax and follow. So making a circle with your toes, going round, start small, and now you'll start to see the different movement in the knee joint, and you'll start to feel the strength in your leg. So if you rest your hand on your thigh, change direction, you'll start to feel the strength now that you're developing in your leg by making this movement. And this is an important thing, to develop the strength in the legs to support the joint. So if the muscles are strong, they will support the joint and put less load through the joint because we're using the muscles more. So that's very, very important. Change direction, and this is the way to develop strength, as is the next exercise. Always start small and build up if you can. So the next one then, again developing strength, is to lift up the heel, and as you lift up the heel you'll see your knee will start to move anyway, and if you can, lift the knee and point out the toe. Now if you're not able to lift at this stage because we don't have the strength or there's too much discomfort, then still lift up your heel and slide your foot forward. So still make that movement, but without having to lift up. If you can lift, and this develops much more strength here. But this strength is not at the expense of twisting. So try and keep your pelvis relaxed, nice easy circle with the leg. And then we change direction, you point the toes out, and then lift the knee and rest down. So you can see this is nice and still. I'm not leaning and twisting here. Just nice and comfortable. Toes out, knee up, heel down. Toes out, knee up, heel down. Good. So that's a general introduction. Little bit of movement. Think about the principles, and I look forward to seeing you all again with another of the Action for Elders videos. Check out the Action for Elders YouTube site on the website www.actionforelders.org.uk, and you'll find lots of resources there and can make contact with us. Thanks very much for listening. I hope to see you soon. Goodbye.